I'm gonna start recording.
Okay.
But let me wait. This is not full screen. Full screen. There we go. Okay. Let me grab my timer.
Can you say like 3, 2, 1 or something?
Yeah. So whenever you're ready to go, Luke, go for it.
Okay. Is it recording right now?
It is. Yeah.
All right. 3, 2, 1. All right. So today we're going to talk about electronic medical records. What are they? Who uses them? And are they the wave of the future? We'll get into a lot of the details, the pros and cons, and ultimately see what happens with it.
So what is an electronic medical record, also known as an EMR? It is a digital version of a patient's paper chart. They make a patient's information readily available in real time to authorized users, such as doctors, nurses, and technicians. It contains access to all of the necessary information involving a patient. It's used to track data over time. It also allows for more organized information regarding a patient. There are local organizations in our area that use EMRs. Some include OSF Healthcare in Peoria, Unity Point Health, Liberty Village, also in Peoria, Clinton County Medical Center, and Heartland Health Services.
Yeah, so as Josh was saying, one of the examples is OSF Healthcare. It's one of the bigger hospitals in the state, really, outside of Chicago. I feel like a lot of people come in from pretty far away. They have life flights, so they're bringing helicopters in with people in there. They use EMR. I think that's a big advantage to what they're doing right now. Like I said, it's one of the bigger hospitals. So I'm in the next one. Unity Point Health is almost like a rival. I don't want to say rival because it's a hospital, and I mean, obviously healthcare is needed here. But it is right across the street from OSF Healthcare, located downtown Peoria, both of them. It's also known as Methodist. It's more lit up than OSF at night. They also use EMR. On to the next one. Heartland Health Services. It's a smaller healthcare service. It's also located in Peoria, Illinois. So if it's almost like an urgent care or prompt care. So it's nice that they have online medical records. So all these medical records, the online versions obviously are going to be tied together, which is very nice. So if you just need a quick visit, your medical record will be right up there at Heartland Health. But if you need to be transferred over to, say, OSF, you can easily and quickly transfer your health records over to there, no problem, without any paperwork. And one interesting one is Liberty Village. It's a retirement community type thing for assisted living. It's like I said, assisted living, senior living homes. It's located in Peoria, Illinois. I think there's quite a few of them actually throughout the Midwest. They also use online medical records, which is nice for the elderly. It's easy for the nurses and for the doctors to get their information if they do need to transfer them over to, like I said, OSF or Methodist. It's just a quicker way. So they're starting to adopt that method to be able to transfer. And Clinton County Medical Center. This one's located in Michigan, which is a little further away, but it's north. So if you are up near that area, you can also send your information. All these things are going to be intertied, so you can, like I've been talking about, you can send your medical records wherever quickly and safely.
And then let's see.
Here are some benefits. Do you want to pause it real quick?
Yeah. It's
I'm
fine.
sorry.
You're good. You're good.
I was
just
muted.
gonna be like, Josh will talk about this one
Oh,
now.
yeah, I was like muted and I didn't realize I was.
No, you're good.
All right.
Okay, yeah, whenever you're ready.
Yep, 3, 2, 1. All right. Benefits of using EMRs. Here are some, but there are definitely more that are. One is it provides accurate and up-to-date and complete information about patients. It also enables quick access to patient records. Sometimes patients need medical attention right away, and digging through papers is not necessarily the most efficient way to find information about a patient, and having this electronic medium can reduce the time doctors and nurses or other caretakers have to look for information. Another benefit is that it enables safer and more reliable prescribing. Sometimes there can be confusion between notes or just between handwriting, and that can cause doctors to prescribe the wrong kind of medicine and indirectly hurt the patient. Another benefit is that it enhances privacy and security of patient data. So paper can be easily looked at, but electronic mediums can have a protected password and can be encrypted to keep patients as safe as possible. It also reduces the cost through decreased paperwork. It helps doctors more efficiently diagnose patients. It reduces medical errors, and overall, it's more organized. It's more organized documents and easier to navigate.
All right, and here are some of the drawbacks of using EMRs across the board. Like anything digital, there's some potential privacy and security issues. These things, like anything else on the internet, are hard to keep track of. They're hard to know who's got access to them. And they're pretty easy to hack into across the board, um, especially since there's people using them who maybe are not as computer illiterate as the people who've designed the program or the doctors who are using it. It's hard to know who's looking at your information with EMRs. You don't know what doctors are looking at it, what nurses are looking at it. And just across the board, you might lose out a little bit on the privacy aspect. EMRs can be tampered with, like anything else on the internet. It's hard to know if they've been tampered with. It's hard to know who's been tampering with them. And that's something that's really hard to catch, which is not good in the medical field. If something like that happens for nefarious reasons or otherwise, that can have really bad impact on the patients. DMRs are going to have to be updated constantly as soon as new data comes out on a patient, or else they're going to be inaccurate, which can take a lot of maintenance. It takes a lot of time updating them. It requires computer and internet access, which people like us who live in a city like Peoria are going to think, well, that's no big deal. But for people in rural areas, this is going to be much harder for them to use. It's going to be hard if the doctors are forced to use it. For a lot of rural communities, their doctors don't have access to stuff like this. And it also becomes an issue if there's a big storm that knocks out internet access, and all of a sudden doctors don't have access to the forms that they need to have to work on a patient. There's liability concerns. There's potentially you're risking the loss of very important information that pertains to a patient's life or death, information that could affect their life insurance potentially. So these are all really big concerns that doctors can have using these. And then time and money, just across the board. Teaching a doctor how to use these, teaching a nurse how to use these, getting an entire hospital to start adopting them is one thing, but then you have to think about getting a patient too to start switching over. Going from all physical forms, all physical everything to completely digital can take a long time and a lot of money to accomplish. And then are EMRs widely used? Across the board, they're getting to be pretty widely used. We find that 74% of doctors use certified EMRs, and 86% of their use is recording patient demographic information. 79% of primary care physicians have adopted certified EMRs, and 56% of them were using all basic functionalities on EMRs. And this graph also shows a little bit how much they're being used and adopted, like across the board. They're becoming almost a required thing. And maybe physical papers will one day be a thing of the past. And then here, Luke will talk a little bit about his personal experience with them.
Yeah, so I have used EMRs to some extent. So I'm a little split between how I've used them. So my primary care physician still uses the paper method, so the old school method. Um, I still have to fill out a sheet every time I go in, and every time I'm switched to a different room, whether I'm doing just a physical or getting blood work done. They're always switching papers back and forth, and it takes a little bit longer than it should. But the sports teams I played for, they do use EMR. So I did play baseball at Bradley, and they use the electronic medical records. They're starting to transition into that. I think it runs fairly smoothly. It's much easier to fill out. If you have an appointment, you just they just email it over to you the night before or whenever, a couple days before. You fill it out, you send it back, and then as soon as you get to where you need to be, you get right into the office. You don't have to sit there, fill something out, fill out a couple papers, and that takes a little bit of time. It feels more organized. Like I said, it makes doctor visits go much quicker. And I would like to see my primary care physician make the switch. I don't know how soon he will do that, just because it feels like that transition would take some time. So eventually he might, but at the moment he seems to be, it's a small enough business to where he can get away with the paper method, but we'll see what happens in the future. And then my personal concerns, although I think it's convenient, I do have a few concerns about it. Not so much with the EMR itself, but the electronics involved, like email, computer hijacking, and data miners. Like if a doctor unknowingly leaves his computer open, you never know who can go in and take a look at that, whether it's another doctor or nurse or whatever, or a different patient that comes in the room. You just never know who's looking at your data. It does feel rather smooth, but I don't 100% trust it yet, just because obviously technology is fairly new to everything, and it's obviously new to hospitals. So I don't completely trust it, but I do trust that even if it gets hijacked, the FBI will get involved if it's a big enough case. Obviously, there can't be much more of a risk than the paper files, because you can also hack paper files. Um, it just has to happen internally inside the office, which I guess there's a smaller chance with paper files because it's not open to the entire world. There will always be a way to hack medical records, like I was saying, if you try hard enough. It is illegal, so I do feel safe knowing that. So like I was saying, the FBI can get involved or whoever. There will be an investigation if you decide to look into it further. So it kind of gives me some comfort knowing that, in a sense, my medical records are safe.
Sure. And then we'll talk about privacy breaches. The risk for privacy breaches is pretty high with anything digital. There's going to be people for some reason who want to get into these things and they want to mess with them. And hackers are very smart, and they're always normally 2 steps ahead of everyone else. So they normally find a way to get into whatever they want to get to. The online data is going to be accessible to everybody in some way, which makes it much higher risk. Whereas paper documents could only be stolen or tampered with in person. But cybercrime happens all the time, and sometimes it's impossible to stop it, as we've seen. So hopefully people have measures in place that can get around this and make it okay, but we'll really have to see what happens. And then a couple of final thoughts from everybody here. Personally,
yeah. Go ahead.
Personally, I think it's smart to get into it, just for how much it helps people across the board, but we'll definitely have to see what security measures can be made to make it safe.
Right. I think I do trust EMRs. I also would agree. I think it's safe. It's kind of early in the process, but I do trust it, and I do trust the people out there that it will be safe.
I trust it as well, and I think that we should try to move to EMRs because like we're at some point we need to evolve as a society and utilize technology as much as we can. Like for example, on iPhones, you can import your medical records on your phone, and let's say you're at a restaurant and you have some medical emergency, you need to show something to someone, you can easily pull it up at the ease of your phone, and it's just a thing of convenience.
But yeah, here's some last suggestions.
Basically, just do your research. Talk to people you trust. Talk to your doctor. See how it's working if they do offer it, and yeah, just do your own research and trust your own opinion.
Woo. Okay, cool. That was perfect. I think we got right to the place we need